Health authorities across the country are eyeing the UK variant, which was already found in several people in the valley. It's a big concern because it's possibly twice as infectious. From stop the spread to stop the mutation, the head of Nevada's state lab is explaining how every Nevadan can stop these variations and keep the vaccines we have working.
That's yet another reason we need to do all these things, keep people healthy, but to keep this thing from becoming something else.
Virus variants, from the South Africa to the Brazilian strain to the UK strain found in 7 people in the valley. We ask, why must every Nevadan care?
How should people take this into their daily lives?
The easy answer from the last year would be to do the things that we talk about with regard to mask wearing and social distancing. These viruses change. They need to understand is that variation is what leads a virus from becoming a bad situation to a worse situation.
Dr. Mark Pandori's the head of the state public health lab, tracking cases and the virus across Nevada and closely monitoring the UK strain, which is twice as infectious. UNLV's wastewater detection program suspects, based on samples across the valley, there may be more cases than we know.
I can't really speculate on how much of it is out there. It's a fair assumption that when you find a few cases, it means that there's more out there.
The message to all Nevadans: we should all know a little virology 101. The more we let the virus spread, the more it mutates. It could eventually evade vaccines.
We have a new reason to want to keep this thing down, and that's that we need to combat this variation process.
Pandori says it's going to take a lot more time and a lot of mutations for the coronavirus to outsmart both Pfizer and Moderna's vaccines. But we can all change the timeline, mask up, social distance, and get the vaccine when we finally can.
The amount of variation is dependent on how much we let this thing creep around in our community.
With all the surveillance across the state, there's been no cases found in Nevada of the South African and the Brazilian variants.